Hello everyone, today we will discuss about the hip bone. We know hip bone is the part of pelvic girdle, and the function of pelvic girdle is it is the connector between the lower extremity with the axial skeleton. And the hip bone, which is composed of three bones, ilium, ischium and pubis. These three bones are connected with each other by triradiate cartilage. So the part of hip bone, the acetabulum or acetabular cavity, is considered as the center of hip bone, because the triradiate cartilage is joined with three bones in the center of acetabular cavity. So if we see the acetabular cavity, we can see it the lunate surface and the acetabular fossa. Acetabular fossa is not articular, the lunate surface is articular. The lunate surface is flat and which articulates with the head of the femur, and which is a ball and socket type of synovial joint, and this represents the shoulder joint in case of upper extremity. And if we see the margin of the acetabular cavity, it is sharp. In living body, it is surrounded by acetabular labrum, which is fibrocartilaginous in nature. Now we studied about the ilium. Ilium, it projects upward like a plate of bones, from the acetabular cavity, which is the center of the hip bone. And the ilium has upper end and lower end. Upper end is considered as the iliac crest, and the lower end is as the center of the hip bone, which is the center of acetabular cavity. And it has three borders: anterior border, posterior border and medial border, and three surface: iliac fossa, gluteal surface and sacropelvic surface. And now we discuss this part in briefly. So the anterior border, which extends from the anterior superior iliac spine to the anterior margin of acetabular cavity. The anterior margin is continuous with the anterior inferior iliac spine from anterior superior iliac spine to the anterior margin of acetabulum. Now come to the posterior border. Posterior border extends from posterior superior iliac spine, and which is continuous with the posterior inferior iliac spine, and there is a concave margin which is known as greater sciatic notch. The greater sciatic notch in case of living body is formed the greater sciatic foramen with two ligaments. Inferiorly it is the ischial spine. Inferiorly here attached to the sacrospinous ligament, and posteriorly it is formed by sacrotuberous ligament. When the greater sciatic foramen is formed, so now we have to know the contents of the greater sciatic foramen. The contents of greater sciatic foramen are the sciatic nerve to the quadratus femoris, and undercover the sciatic nerve, posterior femoral cutaneous nerve, inferior gluteal nerve, inferior gluteal vessel, and nerve to the obturator internus, internal pudental vessel, and pudental nerve. These all structures are passes through below the muscle piriformis. As we know, the piriformis attached in the upper margin of greater sciatic notch. Above the piriformis, it transmits the superior gluteal vessels and nerve. The medial three structures, the nerve to obturator internus, internal pudental vessel, and pudental nerve, again enters into the pelvic cavity through the lesser sciatic foramen. We know about the lesser sciatic foramen next. So this is the iliac crest, and iliac crest extends from anterior superior iliac spine to the posterior superior iliac spine. So now we have to know the anterior superior iliac spine. Anterior superior iliac spine gives attachment to the lateral end of inguinal ligament and the muscle sartorius. And the iliac crest, if we see the iliac crest, we can see it two segment. From outwards it shows convexo-concave nature, because anterior 2/3 of the iliac crest is convex outward and posterior 1/3 is concave outward. So we have to know the attachment of the iliac crest. The iliac crest gives attachment in case of ventral segment. The anterior 2/3 which convex outward is known as ventral segment, and the posterior 1/3 is known as dorsal segment. The ventral segment gives attachment from outward to inward. The fascia lata, then you have to know about the fascia lata. The fascia lata is the deep fascia of thigh. Fascia lata including iliotibial tract. Then as this is the iliac crest, it contains a iliac tubercle of 5 cm posterior to the anterior superior iliac spine. So this is the iliac tubercle. Up to iliac tubercle, it gives attachment to the tensor fascia lata muscle. Then it gives attachment with the external oblique muscle. In case of anterior 2/3 of the ventral segment, then it is bare for the base of the lumbar triangle. Then posteriorly it gives attachment with the latissimus dorsi. The intermediate area of the iliac crest gives attachment with internal oblique muscle, and the whole extent internal oblique muscle, and the inner border or inner lip gives attachment to the transversus abdominis muscle in case of anterior 2/3, and posteriorly it gives attachment to the quadratus lumborum muscle. Now come to the dorsal segment. Dorsal segment gives attachment to the gluteus maximus in the outer slope, and the inner slope gives attachment with the erectorospinae muscle, and the whole extent of the inner aspect of the iliac crest gives attachment to the fascia transversalis. Then we come to the surface. The medial border extends from the iliac crest to the iliopubic eminence. The medial border is divided into 3 segments. The posterior segment is rough. The intermediate 1/3 is sharp to form the lunate surface or the auricular surface of the sacral part of sacropelvic surface, and the anterior 1/3 is rounded to form the arcuate line, which is a part of linea terminalis. Now we have to know the surfaces of the ilium. This is known as iliac fossa, which is intervenes between the anterior border anteriorly and inferiorly, and posteriorly it is intervened between the medial border, and superiorly it intervenes between the iliac crest. It is concave fossa-like structure which is gives attachment to the iliacus muscle, and which is the content of iliac fossa. This is very important for viva and OSPE questions. In case of right iliac fossa, it contains cecum and vermiform appendix. In case of left iliac fossa, it contains descending colon only. Now come to the sacropelvic surface. Sacropelvic surface is divided into 2 parts, sacral and pelvic. The pelvic part is smooth and it forms the lateral boundary of true pelvis, and the sacral part has auricular part and rough part. Rough part gives attachment 3 important ligaments. The ligaments are iliolumbar ligaments, sacroiliac ligaments, and the interosseous sacral ligament. The auricular part is articular. It articulates with the lateral surface of sacrum, which is a plain type of synovial joint. Now come to the dorsal or gluteal surface. This is gluteal surface. Gluteal surface is marked by 3 gluteal lines which arise from the greater sciatic nodes and terminates in the iliac crest. The gluteal lines are inferior gluteal lines. These are very faint bony ridges, but mostly they are absent in most of the bones, but theoretically we have to know about the ridges. There is inferior gluteal line and the anterior gluteal line and posterior gluteal line. And the anterior gluteal line extends from greater sciatic notch to the iliac tubercle, and the posterior gluteal line is extends from the greater sciatic notch to the dorsal segment of iliac crest, and it divides the dorsal surface of the ilium in 4 parts. The most posterior part behind the posterior gluteal line, it gives attachment with gluteus maximus muscle. Then the area intervenes between the anterior and posterior gluteal line, it gives attachment to the gluteus medius muscle, and the area between the anterior gluteal line and inferior gluteal line, and it gives attachment to the gluteus minimus muscle, and the area below the inferior gluteal line, it gives attachment to the reflected head of biceps femoris muscle. Now come to the sacropelvic surface. Sacropelvic surface is divided into 2 parts, sacral part and pelvic part. The pelvic part is smooth, which forms the lateral wall of pelvic cavity, and the sacral part is divided again into 2 parts, auricular part and rough part. The auricular part is articular, which articulates with the lateral surface of sacrum, which is a plain type of synovial joint. And the rough part gives attachment 3 important ligaments. The strongest ligament is the interosseous sacral ligament, the sacroiliac ligament, and iliolumbar ligament. Now come to the dorsal surface or gluteal surface. Gluteal surface is marked by 3 gluteal lines. Gluteal lines are bony ridges, extends from the greater sciatic notch to the iliac crest. There are 3 gluteal lines in the gluteal surface of the hip bone. So these are very faint ridge, are not predominant in all bones, but theoretically we have to know about these lines. The posterior gluteal line extends from the greater sciatic notch to the dorsal segment of iliac crest, and the anterior gluteal line extends from the greater sciatic notch to the iliac tubercle, and the posterior gluteal line extends from greater sciatic notch to the anterior inferior iliac spine. Now these 3 lines divides the gluteal surface into 4 segments or 4 areas. The most posterior area gives attachment to the gluteus maximus muscle. The area between the anterior gluteal line and posterior gluteal line gives attachment to the gluteus medius muscle, and the area between the anterior gluteal line and inferior gluteal line gives attachment to the gluteus minimus muscle, and the area below the inferior gluteal line gives attachment to the reflected head of rectus femoris muscle. The rectus femoris muscle is the muscle of thigh which has 2 heads. This is reflected head, and it has also a straight head which arises from the anterior-inferior iliac spine. In case of pelvic surface, there is a faint sulcus known as preauricular sulcus. It is absent in case of male pelvis and nulliparous women's pelvis, but it presents in parous women's pelvis. Now come to the ischium. Ischium is one of the part of hip bone which extends from the center of the hip bone or acetabular cavity, which form the posterior inferior 2/3 of the acetabular cavity. The ischium has body and ramus. The body of the ischium has 3 border and 3 surface. The borders are anterior border, which is the posterior border of obturator foramen. This is obturator foramen in living body, which is covered by obturator fascia or obturator membrane. And the another 2 borders are posterior border and lateral border. The posterior border is the continuation of the posterior border of ilium, and the lateral border is the continuation of the outer and inner border of ramus. These three borders divides the body of the ischium into three surfaces. This is pelvic surface, which is intervenes between the anterior border and the posterior border, and the dorsal surface intervenes between the posterior border and the lateral border, and the femoral surface intervenes between the anterior border and the lateral border. The most important portion of the ischium is ischial tuberosity, which is situated in the dorsal surface. The ischial tuberosity again divides into upper part and lower part by a transverse bony ridge. The upper segment of the ischial tuberosity again divides into superolateral and inferomedial portion by a oblique bony ridge. The superolateral surface gives attachment to the semimembranosus muscle, and the inferomedial surface gives attachment to the semitendinosus muscle along with long ischial head of biceps femoris. Lower portion of the ischial tuberosity again divides into outer portion and inner portion by a vertical bony ridge. The outer portion gives attachment no muscle, but it is covered by fibrofatty tissue. The inner portion gives attachment to the ischial part of adductor magnus muscle. These four muscles are known as hamstring muscle. They are the portion of they form the portion of the thigh, which is the muscle, which are the muscles of the posterior compartment of thigh. Now come to the ramus. The ramus of the ischium is joined with the ramus of the pubis. This is known as conjoint istiopubic ramus. The ramus of ischium and pubis are joined together by a primary cartilaginous joint, and they are joined within the age of 7 to 8 years. The ramus has outer surface and inner surface. This is inner surface and this is outer surface, and two border, upper border and lower border. The upper border gives attachment to the obturator membrane, and the inner surface again divides, again marked by two transverse ridge. These are very faint ridges, not well marked in these bones. These two ridges gives attachment to the superior fascia and inferior fascia of urogenital diaphragm, and gives the inner surface and divides the inner surface into three areas: upper area, intermediate area, and lower area. The upper area gives attachment to obturator internus muscle, and the intermediate area gives attachment to the transversus perini profundus and sphincter urethri muscle, which are the muscles of urogenital diaphragm, and the lower portion gives attachment to the ischiocavernosus muscle, transversus perini superficialis muscle, and the crura of penis in case of male and crura of clitoris in case of female. Due to strong attachment of crura of penis in case of male, the ramus is everted in case of male. Come to the outer surface. Outer surface gives attachment some muscles. The muscles are here. It gives attachment to the gracilis muscle, and below the gracilis it gives attachment to the adductor brevis muscle, and the margin gives attachment to the obturator externus muscle, and here it gives attachment non-hamstring part of adductor magnus muscle. And the ischium contains a spine. This is ischial spine. It has very important significance, because in case of male pelvis it is inverted, and in case of female pelvis it is everted. And the ischial spine gives attachment to the sacrospinous ligament, and this form the laser sciatic notch into laser sciatic foramen. Laser sciatic foramen transmits tendon of obturator internus muscle, nerve to obturator internus, internal pudendal vessel and pudendal nerve. Very important for viva. Now come to the pubis. Pubis has body and two rami, superior ramus and inferior ramus. Inferior ramus is from the conjoint ramus, and the body of the pubis is quadrilateral in outline. And this quadrilateral body of the pubis presents three surface: anterior surface, pelvic surface or posterior surface, and this is medial surface or symphysial surface. The anterior surface gives attachment to the adductor longus muscle, and the superior margin of the pubis, superior margin of the pubis is thickened to form the pubic crest. We have to know about the attachment of pubic crest. The lateral portion of the pubic crest is conical shaped, and this is known as pubic tubercle. We have to also know the attachment of pubic tubercle. Now come to the attachment of pubic crest. Fascia lata, pubic crest gives attachment to fascia lata, anterior wall of rectus femoris. This gives origin of the lateral head of rectus abdominis and the conjoint tendon and the fascia transversalis. And this pubic tubercle gives attachment to the medial end of inguinal ligament. This is the inguinal ligament at the attachment of inguinal ligament. This is medial head and this is lateral head. Lateral head gives attachment to the anterior superior iliac spine. Now come to the another attachment of pubic tubercle. It also gives attachment to the superficial inguinal ring and the superior crus of saphenous opening, apex of the laconal ligament and the reflected part of inguinal ligament and the ascending limb of U-shaped loops of cremasteric muscle. Now come to the relation of the pubic tubercle. Pubic tubercle is related to the vas deferens in case of male and round ligament of uterus in case of female. The superior ramus of the pubis has three border and three surface: anterior border, posterior border and inferior border. The posterior border, also known as pectin pubis, which is continuous with the arcuate line of the ilium. The arcuate line of ilium and the iliopubic eminence, pectin pubis and the superior margin of the body of the pubis, collectively known as linea terminalis. The relation of linea terminalis is very important for viva. The relations is internal iliac vessel in front of sacroiliac joint, then ureter, then ovarian vessel in the suspensory ligament of ovary, then vas deferens in case of male and round ligament of uterus in case of female, obliterated umbilical artery and the median umbilical ligament behind the symphysis pubis. Now come to the symphysial surface of the pubis. The symphysial surface is joint with the symphysial surface of the pubis of another side, which is the secondary cartilaginous joint. And the cartilage of intervenes between the two symphysial surface is known as pubic symphysis, which is fibrocartilage. Now the content of the obturator foramen. Obturator foramen is covered by obturator membrane, but the obturator membrane is not attached in the superior margin, as it forms the obturator canal. Obturator canal transmits obturator nerve and obturator vessel. In case of viva from this hip bone, some questions are invariably asked. And there, what are the primary cartilaginous joint in this hip bone? There are two primary cartilaginous joint in this hip bone. One is in the triradiate cartilage, which is formed by the fusion of three component of the hip bone in the center of acetabulum, and then another is in the conjoint istiopubic ramus. and show the relation of three important nerve of thigh. The three important nerve of thigh are sciatic nerve and femoral nerve and obturator nerve. The sciatic nerve transmits through the greater sciatic foramen, and the obturator nerve transmits through the obturator canal, and the femoral nerve transmits below the inguinal ligament. Now come to the attachment of these bones. These bones articulates with the head of the femur, which is ball and socket type of synovial joint. The articular surface is the cup-shaped acetabular cavity. We discussed it in past. And there is a secondary cartilaginous joints with pubic symphysis, and this is sacro-iliac joint, which is primary cartilaginous in nature. Now another question in Viva, in which age all three components of this hip bone is fused? The answer should be in case of puberty or the age between 15 to 25th year. The ossification. These bones ossifies from three primary center for the body of three major components and many secondary centers. Now come to the anatomical points. In case of anatomical points, you have to say the anterosuperior iliac spine and pubic tubercle lies in same coronal plane, and you have to act this coronal plane by your hand. And the acetabular cavity is directed downwards, forwards and laterally. And the symphysial surface is directed downwards, forwards and medially. And the ischial tuberosity lies below. This is about the anatomical points. This is all about the questions of hip bone. So if you have any query about the any questions in hip bone, then you have to comment in our comment box or post in Kalosam BD study group. Thanks everyone.